So good afternoon, everyone. My name is Brendan Pickluck, a Provincial Improvement Consultant from the Health Quality Council, and I help to facilitate the working group that created the Mental Health and Addictions Outpatient Experience Survey. I'll be co-presenting today with Lindsay Fortin, who is one of our two patient family advisors for our working group.
Hello, this is Lindsay. I've been a peer support worker for mental health for 3 years. I've been a patient family advisor for over 2 years. I've helped with the 3P event to design the new Moose Jaw Hospital, and I'm currently on the committee for increasing value of inpatient time.
So thank you everyone for joining us this afternoon, and for those of your colleagues that were unable to make it today, this presentation is being recorded. And for this reason, everyone has been placed on mute until the end of the presentation for when we get to questions. The link for the video will be sent out, and it will also be available on the Health Quality Council's website. So Lindsay is first going to speak about the impact of patient experience surveying on patient care and why it is important to survey patients.
So someone in crisis may not know what they need. As they move through treatment, they begin to see what is needed and what is available, and it's important to know that people who have previously accessed services find important and helpful to them. When I first started receiving services, I knew nothing about mental health and mental illness. I didn't know what I needed or what was available and how to move through treatment. By having the survey, people who have gone through this can share their experiences in order to help others. As someone moves through, they better know the areas that are important to them, and their feedback can help improve care for the next patient.
So we will now give you a brief history of the creation of the survey. The Mental Health and Addictions Outpatient Experience Survey was created by the Care Experience Working Group, a working group that consisted of patient family-centered care leads, patient family advisors, and mental health and addictions directors, managers, and staff. I'd like to thank them at this time for their hard work on this survey tool.
Everyone in the group helped through the stages of the survey. I felt comfortable in the group and was able to share my opinions freely. I'm very proud to be a part of this and of the survey we came up with. Our goals when starting was to create a survey to be used for mental health and addictions across Saskatchewan. We wanted the survey to be as easy as possible to complete in order to receive results that would be helpful to improve or change current services. We had a number of surveys from across the province, as well as ones outside of Saskatchewan. We ended up focusing on a survey from Ontario that we chose because we liked the format. To begin with, we narrowed down the number of questions. We had to do this step many times to get rid of the link and come up with questions that were relevant and could be used to see where changes in services could be made. We ended up with a total of 28 questions.
We'll now do a quick run through of the survey, and I'm just going to show you where the survey can be located. So the survey is actually on the Health Quality Council's website at hqc.sk.ca. From there, you can go to the How Our Healthcare System is Doing, and from there, scroll down to the Mental Health and Addictions Outpatient Services Survey. We have to open up that accordion, and here we can find the survey.
We wanted to keep the survey as easy and short as possible so more people could feel comfortable completing it. I personally think that too many comment questions is intimidating. We were able to tap back to 3 comment questions on overall experience, what was good or bad. We decided to put the demographic questions first to make it easy to get started. The survey is formatted with checkboxes so it could be put on SurveyMonkey. We spent a lot of time rewording questions so they are easily read and understood. and that the results from them could be used for improvement of services. The questions are grouped into client information, access entry to services, services provided, my care team, environment, end of program or treatment, and general experience sections. This survey is meant to be flexible, so you are free to use parts, or the whole survey for your surveying needs.
I'm now going to talk about how to administer the survey. The working group did have a hard time trying to decide how the survey should be administered, but landed on a flexible approach. This approach was decided upon because mental health and addiction services are provided in a variety of settings, such as large facilities, small facilities, in groups, or one-on-one. It would be up to the area doing the surveying to decide how they would like to administer the survey. The working group also updated the patient experience surveying Getting Started toolkit to be applicable for surveying in all healthcare environments. We'll now show you where that toolkit is located. So it is on the Health Quality Council website, and next to, just below the survey. The toolkit contains background on patient experience surveying, how to begin surveying in your area, sample size, selection, how to process and understand your results, and what to do with your results when you have them. There are also multiple appendices with multiple tools and great examples from across the province that are in use. I encourage you to take a look through this toolkit when you start planning your surveying. I'm now going to direct your attention to the Survey Analyzer tool for the Mental Health Outpatient Experience Survey. This tool will process your results and automatically create a run chart for your results. So it is also on the Health Quality Council website, and it's actually just right next to the survey. So I'll first do a high-level overview of the tabs, followed by an example with inputting some data into it. The first tab is the Instructions tab. It contains the instructions on how to enter the data and how to modify the run charts. The next tab is the Survey Coding Guide. It is a reference sheet for inputting survey results. Each answer to a survey question is assigned a numerical value for input into the spreadsheets on the next tabs. For the most part, the numbering goes from left to right, starting with 1 up to 4. The next set of tabs are where data is inputted. There's actually 2 years worth of tabs that you can input data into, and I'll go into those in a little bit more detail in the next little bit. So we'll scroll through those tabs. And the next tab is the Formulas tab. This is basically where the magic happens. So basically, don't alter anything in the gray boxes. They're the ones that contain the formulas. The colored boxes are the ones you can alter, and those ones indicate are for adding baseline and goals to the graphs. The next set of tabs, all I have to do are all the graphs that are available. So now I'm going to actually walk you through with inputting some data into the survey. Into the Survey Analyzer tool. I'm just going to change my screen looks. So I have a survey that's actually been completed. you can see some of the check boxes that have been clicked off. So first thing we'll do is we'll just kind of number which survey this is. This is this is question survey number 4, and I put in a couple of questions already. So we'll start with question number 3. So we have Caucasian here for race or ethnicity, and if you come over to the data coding guide, that's a 4. So we can input 4 for that selection. The next one for question 4 is how far did you have to travel to access services? 50 to 100 kilometers. Come over to the guide, and that is a 2. Now, I'm not going to walk you through and input every single question on here, but I'll skip to question 7, just get past the demographic questions, and I'll highlight a few things. In these questions, first one was answered as an always, so that is number 1. I'll say it's getting a little bit made a typo and tried putting 124. It's not an acceptable range between numbers 1 and 4, and it actually shows up as being red. The next thing I'll make notice of is on question 8, there's actually a not applicable. So for that question, we actually just leave the cell blank, and that way the denominator is not counted into that question isn't counted into the denominator for the graph. So now let's look at our graph for question number 8. Let's scroll over to question number 8. So now let's say we want to, or question number 9, or 10. So now let's say we want to add on a baseline and a goal for this graph. So what we'll do is we'll go back to that formulas tab, find question number 10 in the gray box area, scroll over to question 10, and here's our baseline and goal area. So maybe we want to say if you found out your baseline was 25, we want our goal to be, say, 95. And let's apply that goal, or the goal and the baseline for the next year. We'll scroll down to next January and apply those baseline and goals to be on there. So if we go back to question number 10, you can see that we do have both the baseline line and the green goal line. Now, this kind of looks a little bit awkward now with just these goal lines like this for the next year and the baseline goal, and with our data. So what we can actually do is we can change our horizontal axis, or what our date range is. So how to do that is do a quick double click on the horizontal axis, and we can change our date range to go from January 2018 to end on December 2018. So we have we have 1 year's worth of data. So now you can see that that we have shortened the graph to include this current year's worth of data and really narrowed those ranges. So the last thing I'll direct your attention to is the text box in the lower left corner. This is where some of the additional information that you can input onto the graph. So things like the date prepared, or when the graph was created, who should be contacted, about the graph, and then also the source. We put in the mental health outpatient experience survey. also which survey question, what was the actual question that it was, and then talks about the numerator and the denominator, so how these scores were actually calculated. So that's kind of basically it for our presentation today. And what I'm going to leave you with is if you do run across any concerns or have questions or need help, direct your attention to contact Nirmal Sidhu at the contact information at the bottom of the instructions. He's more than happy and more than happy to provide any help to you if you need it. So now, just going to open up the lines and allow, if you have any questions, concerns that you'd like to share. So I'm just, all right, so I've unmuted all lines now. So if you have any questions, feel free to ask.
Thank you very much for the presentation. This is Penny calling from Swift Current. I'm wondering about, are there some suggested timelines you're asking for here? And also, is there an option for the survey to be completed by paper for the clients who may not have an affinity with email or online?
So to answer your second question, there is the option either to do it by paper or electronically. It's, yeah, quite flexible. There's, within the how-to survey toolkit, there, it goes through kind of the different options on that regard. And in time frame, I might get you just to elaborate a little bit more on that question.
I'm wondering, are we asking for a particular start date? Are we just suggesting when it's ready, clients will start using it? Are we asking our practitioners to have every client use it? What sort of parameters have we thought of to get good data?
Yeah, so in regards to this survey, it's been designed for local improvements at the point of care. So what we've put out for is for Matters Work, and basically it's up for individual areas to create, to administer the survey as they see fit. So from a provincial perspective, there's no start date, you must start by this time. There's no, rolling up. It's really meant to make those local improvements at the point of care.
Thank you very much.
You're welcome. Are there any other questions? Well, not hearing any other questions, please do not hesitate to contact me if something does come up. I will also be sending out an email in the next few days just with communications out to directors as well as managers and the PFCC leads regarding the rollout of this survey. So like I said, please feel free to contact me. And thank you all for joining today.